Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. When you have a chronic wound that won't heal, you may want to consider hyperbaric oxygen therapy. According to Dr. William Palco-Schra with the San Juan Regional Medical Center's Wound Treatment Center, many chronic wounds fail to heal because the tissues in the wound aren't getting enough oxygen to repair the damage. That's where hyperbaric oxygen therapy comes in. Developed out of research related to deep-sea diving, hyperbaric oxygen therapy exposes patients to pure oxygen delivered under increased atmospheric pressure to literally force your blood vessels to carry more oxygen. The increased oxygen in the bloodstream stimulates the growth of an extension of small blood vessels that can carry oxygen into the wounded tissue to help the tissue heal.
The typical wounds that we are treating are things like a diabetic foot ulcer that's not healing, that's gone into deep structures, involves a bone infection, for example, that didn't respond to 30 days of antibiotics, that kind of thing. Or another common issue is people have had radiation therapy for cancer, say. The long-term effects of radiation are to basically dry up tissues. The blood vessels and other tissues become stiff and woody, and the perfusion and blood flow in an area diminishes. And then if they can have either breakdown in those tissues primarily for that, or if there's a new trauma or a new surgery in that area, it just will not heal unless you do something like that.
Patients are placed in a plexiglass enclosed tube, and oxygen is pumped into the chamber, and the atmospheric pressure is increased up to 2 times that of the atmospheric pressure outside the room.
In the room you're standing in, the pressure in the room is 1 atmosphere. It's the weight of all the gas in the room out through outer space. You know, so the weight of the gas in the atmosphere in this room is 1 atmosphere. In the chamber, typically we have people at 2 to 2.5 atmospheres. I think the low end of treatments that actually work is like 1.5 atmospheres. And we go up to 2.4 atmospheres in our treatments. And those protocols are predicated on A, what works, and B, other safety limitations.
Patients typically experience increased pressure in the eustachian tubes of their ears, similar to the pressure changes you may feel coming down to lower altitudes after being in the high mountains or changing cabin pressure in an airplane. Treatments last from 30 minutes to a couple of hours, and a serious wound may require 40 treatments or more. But leaving a chronic wound untreated could be far more inconvenient than scheduling the oxygen therapy sessions. Untreated wounds can lead to systemic infection, dying tissue, or amputation.
Well, first of all, that this is about as safe a thing as we do in medicine of significance, and that's good to know. And the other thing to know is that if you have a wound that's not made progress and is not healing in 30 days, then probably you should have somebody of some expertise look at that.
The San Juan Regional Wound Treatment Center recently received certification by the Undersea and Hyperbaric Medical Society, indicating that the center meets best practices in hyperbaric oxygen therapy. If you'd like to know more, visit San Juan Regional Medical Center's website at sanjuanregional.com. I'm Deborah Uroda for Healthy Living in the Four Corners.